Obviously, our knowledge expands or increases by our ability to do trials. In the cancers that are not as common, we are limited because we don't have enough studies to back us up on new drugs or treatments. But right now there's a tremendous focus right from the FDA all the way down to our clinics and all physicians to really to find new answers. So some of the ones like you mentioned, the brain tumors, GBM, one of the deadliest. Pancreatic cancer, still one of the nemesis for all oncologists. So one of the big challenges in pancreatic cancer is that it tends to grow in such a tough environment that it makes these really tough scar tissue, fibroblasts around it, that is hard for chemotherapy or any agents to get in there. Esophageal cancer is related to more increased incidence of reflux. So the way we're making progress is by slowly teasing away at the makeup of these cancers. So a simple example, in esophageal cancers, at least we found two chinks in the armor of the esophageal cancer. There's a marker known as HER2, which interestingly was found in breast cancers. And we extrapolated the data and said, let's check and see if esophageal cancers express this. And yes, they do, in a small number, but they do. But the good news is in the people who do overexpress it, the same drugs work miracles. So we have patients who have HER2 positive esophageal cancers who do a lot better than the standard treatment options. So that was one. Likewise, we're looking at something known as microsatellite instability. When we find that the microsatellite instability is high, the immune therapies, which we're now so commonly using in lung cancer, head and neck, kidney cancer, bladder cancers, they work marvelously. Now, granted, there's a small percentage of the big numbers, but each patient is important. So if you find that one chink in the armor, you made a big difference. So I think the ultimate solution is in more trials, which is why we're so proud of Florida Cancer Specialists. We just have such a big focus on trials, and it's our responsibility, all of us, not only to take care of the patient now, but also future generations. And that's how we're going to do it, is more trials, more studies, asking the right questions. But ultimately, the big breakthrough that is coming through, I think, is really just teasing apart the makeup of the cancer, just seeing what is driving it at the very, very, very basic level. And that's still a very hard question to answer. We're learning more. We've learned a lot more. In the cases where we found those, we've made leaps. And where we haven't yet, we're still struggling a little bit. So I think the focus is on, like we call orphan cancers, you can call it, and their orphan drug status is given to cancers that, in breast in particular, we have great treatments for breast cancer, but one we don't have good for is triple negative. It's a rare but very aggressive cancer, and we unfortunately but we have luckily found some really good options. We actually have 2 or 3 trials right now ongoing in Florida Cancer Specialists, which have been tremendously helpful in furthering the field. So we keep making progress one day at a time.